Hey, I'm Josh. I know most of y'all either know me or have heard about me here in the community, but I work with You Belong, and I'm also a licensed mental health counselor, and I'm the only HRT specialist in this state that actively works with individuals who are seeking gender-affirming care or an active transition, that are looking for a therapy piece that goes along with their transitional goals. And so what I do primarily is to help individuals contact their doctors or their nurse practitioners, anyone that's in their primary care will, and make sure that their hormones are the levels they need to be, that are effective for their care. Because a lot of individuals don't know this, but doctors are not geniuses. They study what they study, and if it's in their wheelhouse, then it's in their wheelhouse. But active transitions are something that is not taught here in American schools. They are taught overseas where it is illegal to be transgender. They still teach transgender care inside their medical schools. So I feel like that's something that America needs to work towards as well. But until then, I would love to be the piece that fits in the middle. So for the past 10 years of my professional career, I have primarily worked with individuals who are seeking some kind of gender-affirming care for their non-binary or genderqueer status, or in an active transition. And so my job really does educate and help individuals achieve that goal that they're looking for. And with HRT and its gender affirming properties, I can help individuals really shape what their goals and their future looks like during their transition, before their transition, and after their transition, so that they're getting well-rounded, holistic care. And just to talk a little bit about HRT, I'd like to kind of like spread the word about what HRT is altogether. So anything at all that has to do with hormones, from the Pitocin that's giving, here and there for certain issues, from testosterone and estrogen, all of it has to do with HRT. And so when we talk about HRT, you can't just limit it to individuals who are going through transition. It also includes individuals who are on birth control, or individuals who have natural low levels of either estrogen and testosterone that need to have their levels accommodated so that they can experience a full, fulfilled life. Most individuals do not know that estrogen, Pitocin, and testosterone really do affect the neurotransmitters, how the neurochemistry functions. It affects everything to do with your body. So a lot of people think that food and water are our gas that move our engine called this body, but a lot of times it's hormones doing that you're not aware of. It's the reason why hormones work with the endocrine system, works with all the systems in the body, so that you're running in a more well-oiled machine, if you will. Having said that, there are also limitations to what hormones can do. If you are an individual who is seeking, gender-affirming care at a place that does not practice good, safe, ethical medical practices, then they may be superdosing you. Superdosing on testosterone will actually freeze your vocal cords. It does not help your active transition at all. Superdosing on estrogen will do the same, actually. It'll affect your neurochemistry. It'll affect where your body is deciding what to use these hormones for and how to evolve the body. So having the knowledge about HRT on its basis and how testosterone and estrogen work in a cycle to transform this living thing that we have called a body really does help providers know what is safe practice and what is not safe practice. I've had plenty of nurse practitioners and doctors call me and go, hey, I've got this client who is starting on HRT and they've had X, Y, and Z issues in their past with certain drugs or certain hormones. Like, what do you think would be a best case practice for this individual? And we really work on it. For individuals who are transitioning, does monotherapy work best for your body, or does the dyadic therapies work best for your body? What do you want out of your transitional goals? Not just let's throw you on a medication and call it a day and hope that everything works out, because as we've seen in our history, that doesn't go well. So be mindful about what you hear out in this world and how the HRT is affecting every soul here. A lot of individuals in our country are on some form of a birth control daily to affect how their body's responding to menopause, or how their body is responding to all different kinds of disorders. And most people don't know that that added estrogen in your body off of the birth control can actually affect your neurochemistry. Do I understand as a practitioner and as a human that people use birth control for a lot of means that are required and that have to be on it? Yes, I do. But if you do not have to be on it, you should not be on it. It does affect your neurochemistry and it affects your pituitary gland. When you take a estradiol birth control, you are telling your body that you are pregnant. Now, all of us out here that have had any kind of high school education, what do you think that does to your body in a 10-year process, a 5-year process, a 3-year process of being pregnant hormonally the entire time? It affects your neurochemistry. It affects your weight gain. It affects how you treat people around you. It affects how you interpret what you're experiencing through the stimulus that's in this world. And so, unfortunately, we get the mama bear syndrome that comes out. But again, if you poke a pregnant bear, what do you think is going to happen? So, HRT is something that really does affect every single living American soul. And so, I want to be that voice that says, no, government, we're not going to stop doing what we do. We're going to continue to push this forward. Thank you.